Parkinson's. Get it on time, saving you time. Why do you need to watch this 15-minute presentation? Phil Walkerdine has Parkinson's. He was admitted to hospital with a type of pneumonia. He was very grateful for the care that he received in hospital, but if he'd been allowed to take his own medication or been given his medication at the correct times, it would have avoided the extra pain and stress that was caused. His Parkinson's would have been managed and it would have saved the nurses time. It's vital people get their medication at exactly the right time for them as an individual. And it's vital that you understand some of the many Parkinson's symptoms. Don't press stop now. Don't think you'll come back to this later, because you know you won't. Watch it all the way through. If you don't, you may miss something you really should know. If you do, the knowledge you gain will save you time in the future and avoid the sort of experience Phil had for your patients. What is Parkinson's? Parkinson's is a progressive neurological condition, a slow progressing condition, and it can affect movement, but there are also a wide range of symptoms. Some of those will be physical, some mental, and some emotional symptoms. But the really important thing to be aware of is that everyone with Parkinson's is very, very different. And in fact, each person with Parkinson's can differ over a 24-hour period. There's two reasons for that. One is medication can have different effects at different times of the day. And also the condition itself can fluctuate throughout the day. So sometimes someone may have one particular symptom and another time of the day that may not be present at all. We can make assumptions about people with Parkinson's, but are they always right? Do you think this patient can safely drink a cup of tea? So this is what we call a Parkinson's tremor, the pill roll tremor, like rolling a pill round in your hand. Affects you all the way down one side of the body and always starts on one side only. But later on the person may then get the tremor in the other side as well. And it's going to progress over time and become more and more severe. So that gentleman was at rest. Now he's going to have a cup of tea. Can you see how much better his tremor is? Because he's being active and his tremor will lessen or disappear on activity. So don't assume, just ask him. Another assumption we might make, why does this patient suddenly stop walking? What's the reason for that? We have something in Parkinson's some people are affected by called freezing. And when somebody freezes, they become frozen to the spot, they become stuck, they're unable to carry on walking. There are certain places that can trigger this. Some of those are doorways, some of those are changing floor surfaces, narrow spaces, big wide open spaces. And sometimes people use cueing techniques, so counting 1, 2, 1, 2 to help them get walking again. So you can see this gentleman's walked down the corridor and suddenly he's stuck in the doorway, he doesn't seem to be able to carry on walking. And sometimes people put something on the floor, a strip of paper to step over as well, and that can help them to get walking again. Why does this patient look so miserable? This is what we call hyperemia or mask-like expression. It's where you get rigidity in the facial muscles. So this gentleman's trying to smile, but that's not what you see. What you see is a very miserable expression. Don't make assumptions about this. Ask someone how they is. Ask if they've understood what you've said. Why can't my patient stretch their arm like they could earlier on? Well, I saw them do it before. Why aren't they doing it now? Are they being difficult? Are they being awkward? Actually, it might be rigidity in the limbs. And rigidity, like many symptoms in Parkinson's, initially may fluctuate. So you can start off your day without any problems with rigidity in your arms, then all of a sudden it may be there. So this lady, you can see her arm was moving okay and suddenly it's become very, very rigid. Her other arm's going up in the air because she was asked to move it, because often movement on one side of the body will kick in rigidity on the opposite side. So there are some symptoms to be aware of. Slowness of movement is the only symptom that affects every single person with Parkinson's. Everything slows down. Communication problems are also evident in a lot of people with Parkinson's. These can range from stuttering, having an extremely quiet voice that sometimes is so quiet during the day that you just can't hear at all what they're trying to say to you. Sometimes a very monotonous voice. sometimes slowness and poor rate of speech, sometimes a real delay in getting any kind of verbal response from a person at all. But like everything in Parkinson's, there's a sliding scale. So you start off with a very mild symptom, and over time, very slowly and very gradually, it's going to increase and get worse. Bladder and bowel problems are also common, but usually because the person can't get to the toilet or can't tell you they need the toilet or isn't able to organise their clothing quickly enough, rather than the fact that they don't know that they need to go to the toilet. And another big problem is constipation. And constipation is particularly an issue because if a person becomes constipated with Parkinson's, it will stop their medication from being absorbed properly. This must not happen. If their medication is not absorbed properly, their Parkinson's symptoms will be much worse, and they may also get side effects from their medication that are very undesirable. One of the reasons that people with Parkinson's become constipated is because they cut down on their fluid intake because of the issues with getting to the toilet. So please make sure your patients keep their fluid uptake. Some people with Parkinson's will have dementia, Parkinson's disease dementia, which is a dementia associated with a condition, or dementia with Lewy bodies. Make sure you check that you know somebody has a diagnosis of dementia. Don't assume, because it could be a communication difficulty that you're picking up on, not actually dementia itself. And depression, anxiety, worry, these are all very common symptoms again for people with Parkinson's. Eating and drinking difficulties are also common, predominantly because people very often have a swallowing difficulty. And again, that can start off small and gradually get worse and worse over time. Please make sure patients get enough to eat. They may struggle in one sitting to eat their food. It may go cold because it takes them a while to eat it. Just check they're getting enough. Falls are also very common and often a reason why people with Parkinson's end up in hospital in the first place. And pain is very common, and some people will be on specialist pain management alongside their Parkinson's medication. Sleep problems and fatigue are also a very common problem. But the symptom list for Parkinson's symptoms is very, very long. Go and have a look online, have a look at some of the symptoms that affect people. You'll see that it's expansive. But these are some of the key ones that are most appropriate for you to be aware of in terms of having patients with Parkinson's on your wards. So one of the most important things, if not the most important thing about Parkinson's, particularly when we're looking at a hospital setting, is making sure that people get their medication on time. And that doesn't mean when you do a drug round, it doesn't mean when you think it's appropriate or when you've remembered half an hour late. It's vital that people get it at exactly the right time that's appropriate to them. And when they're admitted to hospital, they will be able to tell you what time they take the medications. They'll be able to tell you which medications they are and exactly the time that they need to take them, and that must be stuck to. Otherwise, you could end up with a patient whose Parkinson's isn't very well controlled and they're having very nasty side effects from their medication, and that's not a situation you want to be in. There are some challenges to Parkinson's medication. One of the things that you could come across is something called switching off. And switching off is when somebody's medication actually overstimulates in the brain, but it causes untreated Parkinson's, as if they were suddenly not on any medication at all. That might last for just a few minutes, but it could last for half an hour, 2 hours, 3 hours, 4, even more. This lady's just going to explain what switching off is like for her.
Like somebody taking a plug out of a bowl of water. You can feel your energy going down the plug hole and you just fade into nothing. Or the other way I can go off is to have terrible cramps. They start in my legs and work up my body. So it affects my whole body and I can't speak and I can't feed myself or anything.
Some of the other medication challenges include wearing off, and that's when someone's taken their tablets, they're not due the next dose for a while, and slowly the tablets are running out. We can't keep increasing doses, particularly because of the side effects that the medication can give. So somebody will be able to tell you what time they take the medications, and they will also be able to tell you what time they wear off if they do, and they don't really want to be going for an assessment when they're wearing off or anything like that. It's not a good time for them. And then some of the side effects of Parkinson's medication: nightmares, hallucinations, good or bad, confusion and impulsive compulsive disorder are all side effects of Parkinson's medication, not the condition themselves, but side effects. Impulsive compulsive disorder I particularly want to flag up because This is really important if somebody is demonstrating impulsive and compulsive behaviours that are problematic. It does need reporting back to their Parkinson's nurse or their consultant, and often the person themselves doesn't see the problem, so they haven't passed that information on. Now, this can be something that manifests in a simple way, like an obsession with picking all the little bits of lint off their clothes consistently and continuously. Or it could be a gambling addiction. It could be hypersexuality, using inappropriate sexual language and or behaviour. If someone with Parkinson's is presenting like that, it's most likely to be because of their medication. And then dyskinesia. Dyskinesia is caused by long-term use of Parkinson's medication. It's a writhing movement. It causes a lot of embarrassment to people, a lot of weight loss and a lot of fatigue. So you'll see with this lady, she's very dyskinetic, but she won't be like that all day. Sometimes she'll be very still as well, very slow and very still. But at this moment, she's very dyskinetic. And it's very, very embarrassing for people.
This video illustrates the importance of patients getting their Parkinson's medication on time. This lady's missed 2 or 3 doses of her medication in the morning, and it's caused her to have problems getting up out of her chair. She's got difficulty with her walking, she's got gait initiation problems and freezing. This lady would struggle to go to the toilet by herself. She'd need to call a nurse to take her to the toilet. She wouldn't be independent in her bed area. She'd need help for somebody to come and get things out of her locker for her. She'd need a lot more care than she would have done if she hadn't missed those doses of medication. This now shows the same lady when she's on her normal medication regime, and as you can see, she's freely able to get up out of her chair without problems. She's able to walk to the end of her bed. She is a little unsteady, so she would need a walking aid to help her get to the toilet, but she would be able to do this independently. She wouldn't need to call a nurse to help her get to the toilet or to get anything out of her locker. She'd be independent and able to care for herself.
So you can see from that clip what missing a few doses can do to somebody with Parkinson's, and that's a mild effect. It could have been much more dramatic. It could have been somebody who then was very, very confused, or who was hallucinating. Again, things that you really don't want to be happening on your wards. But you can see here, even with that change in mobility, a lady who would have been able to take herself to the toilet, no longer being able to do so. This is something that you don't want to happen, and that's one of the reasons it's so vital that you ensure that people get their medication at the right time. But even outside of the hospital setting, once that patient's discharged, their medication becomes messed up over a period of time in hospital. It could take them months to get back to normal. So it's so important that you don't put them into that situation. There are some other issues to be aware of. One of them is nighttime. Many people with Parkinson's are on little or no medication through the night, and that's to get best use of their medication in the daytime. But that can cause them to be very rigid at night, which means they will need help with turning over in bed through the night. And mornings will therefore be very difficult as well until their medication in the morning gets into their system properly, so that will take some time. Nil by mouth is also a particular issue. Do have a look to see what your local policy is. But there are some things that can be done around nil by mouth. You can have a look at somebody maybe having medication through an NG tube, through a PEG if they're PEG fed, and then possibly they may look at using something like apomorphine or a tigotine patch. Apomorphine is a particular medication that is injected or is on a pump for a constant release, and again can cause a problem when someone's admitted to hospital if their staff don't know what the pump is and haven't used it before. It is simple to use. The company itself will give you advice and information. Parkinson's UK has a fact sheet around this with the information on it. Have a look at it now. Don't wait until you have a pump come into your hospital. And some hospitals have set up a system where they have super users for apomorphine pumps, so when someone's admitted you can go to that person, and there's more than one of them, to find out how to use the pump. And with tigotine patches, these are a drug patch that's put onto the skin, has to be moved around the body because it tends to irritate the skin, and as I said before, are often used as a last resort when somebody is nil by mouth and they're not able to take oral medication. But some people are using them already as their part of their medication regime. So please do remember, it's really important to listen and respect people with Parkinson's and their families. They know about this condition, they live with it every day. If they make a fuss about how something is or isn't happening, there's a reason for that. Please make sure your patients do get the medication at the right time that's appropriate for them as an individual, not how it suits your ward and your ward rounds. There are a variety of resources available from Parkinson's UK and the UK Parkinson's Excellence Network that can help you to provide a better service for people affected by Parkinson's. Please go to parkinsons.org.uk and parkinsons.org.uk/excellence network to find out more. Thank you for listening.